Good afternoon, respected chairpersons and dear audience. I'm going to present a paper on a role of hypertension on serum biochemical variations in urinary stone patients. And already we discussed about the prevalence of urinary stone disease around the world, and is increasing. And already we discussed about the multifactorial association with the factors with the urinary stone disease as well. So the levels of serum biochemical parameters are critical in treating the urinary stone patients. And the role of hypertension in causing the urinary stone is not yet well described. So few studies are there still. Previous studies have reported that diabetic is associated with the urinary tract infection and is also associated with the urinary stone diseases. Now, around the world, the diabetic prevalence is increasing, and diabetic and hypertension also associated. So, hence, as the diabetic increases, hypertension chance also increases, then the chance for urinary stone disease also may increase. So, this study aimed to find whether how the serum biochemical parameters vary with respect to different levels of hypertension. So what we did, the study was conducted in the urolithiasis clinic in Trivandrum, Kerala, India. We have included 826 urinary stone patients. The biochemical values of blood samples of all patients were assessed. The parameters like hypertension, age, gender, and urinary infection was also studied. These were assessed. The statistical test used here was analysis of variance, and the post-hoc test was used to test whether which group differs significantly if the analysis of variance shows a statistical significance. The serum biochemical parameters included the study was creatinine, calcium, phosphate, uric acid, and magnesium. As I mentioned, 826 patients, you can see most of the patients are male, around 81%. Coming to the distribution of hypertension, around 40% with normal, and 33% with the stage 1 and 27% with the stage 2 hypertension. This table I'm showing the association between the hypertension and gender. We can see there is an association between hypertension and gender. You can see among male, the hypertension, stage 2 hypertension is higher compared to the stage 2 in female. It's 80.9 and 29.2 respectively. So this association, why we did this association, because the gender is actually a confounding variable. To see whether confounding variable and the hypertension and the association is there, then we have to include the confounding variable also at the end. This table, where you can see the serum creatinine level and serum calcium level with respect to different levels of hypertension, normal, stage 1 and stage 2. So with respect to creatinine, there is no statistical difference you can observe, but with respect to calcium, you can see there is a statistically significant difference you can see here. As the level of hypertension increases, the serum calcium level also increases. So 9.09 in normal, whereas 9.92 in the stage 2 patients. Coming to the phosphate, again, there is no statistical significance, is almost same. But in the case of uric acid, again, it's increasing as the stage of hypertension increases, which shows a statistical significance again here. Coming to the magnesium part, magnesium also not showing a statistical significance here, is almost same in different stages of the hypertension. This, so two things we observed statistically significant. First one was serum calcium. So then we did a Duncan multiple range test to see which group actually differs significantly. We can see here the group 1 and 2, normal and stage 1, there is no statistical significance, whereas in stage 2 with respect to normal and stage 2 with hypertension 1, the significance we observed here. Now coming to next, the uric acid, you can see the same observation you can see here as well. In stage 1 and stage 2, the statistical significance is observed, and with the stage 1 and normal also some difference is observed. Now, coming to the discussion, stone formers are found to have a higher risk of hypertension compared with the control hazard ratio of 1.5, which means those with hypertension, the chance for the stone formation is to be 1.5 times more. The studies reported. Studies also suggested an increased risk of hypertension with patients with kidney stone, and the mechanism by which the stones lead to hypertension is not very clear. But the urine, the chemistries could potentially mediate the risk of hypertension, particularly urine sodium and calcium. Our study reported, another study reported that the kidney stone are a risk factor for hypertension, but it's not vice versa. So conclusion of this study is there is a statistically significant difference in serum calcium and serum uric acid among patients with the different levels of hypertension. So thank you so much.